Turning now to health news, especially if your feet, especially your heels, are hurting. We've got some important news for you tonight.
A new study finds that heel pain is often misdiagnosed. CBS 2's Dr. Max Gomez says that means the therapy that you're prescribed may actually be doing you more harm than good. Dr. Max?
That's right, Christina Maurice. By far the most common cause of heel pain, or it's sometimes called a heel spur, is something called plantar fasciitis. It's an inflammation of the ligament band at the bottom of the foot, kind of like shin splints of the foot. Trouble is, a lot of what's called plantar fasciitis really isn't.
It feels like there's a nail being driven right up through your heel, and it's painful.
It's a classic heel pain description of plantar fasciitis. In fact, that's what Kathy Aquila was being treated for. Trouble is, she didn't have plantar fasciitis, and she wasn't getting better.
After 5 years of suffering, I mean, there were times when I'd be shopping or something in the mall and actually sat down and cried because I didn't know how I was going to get out to my car.
Podiatrist Dr. Rock Positano says he's seeing many patients like Kathy misdiagnosed with the condition.
A person who has heel pain can have other types of problems going on that could actually cause the heel pain, such as blood clots, systemic arthritis such as rheumatoid arthritis and gout, even metastases from a tumor.
And a study by Dr. Positano in the Journal of the American Podiatric Medicine Association finds that when feet were scanned with ultrasound, between a quarter and a third of plantar fasciitis cases actually had tears of the ligament in the soles of their feet.
Quite often people will recommend stretching if a person has quote-unquote plantar fasciitis. However, you can imagine if a person has a plantar fascia tear, what happens when you stretch that tear? What you're usually doing is making the tear bigger.
Some of the painful feet actually had a cyst under the ligament, which pushed it out and caused pain, again calling for very different treatment. A good ultrasound scan can tell all these conditions apart and help decide on the right treatment.
No pain ever, ever. Not in the morning, not in the afternoon, not after being on my feet all day.
But that took about 2.5 years of treatment for what turned out to be a tear in Kathy's plantar fasciitis, or plantar fascia, or ligament. Heel pain can be many things, some very serious. So if you're not getting better with standard therapy, insist on a full workup with ultrasound to make sure the diagnosis is correct. Especially a lot of women with high heels, and then they start going flat-footed.
I wouldn't know.
No.
I wouldn't know about that problem.
Like this.
I know.
You know, she's like a foot shorter than me.
Well,
right?
you guys are so tall. I have to wear them just to keep up with you guys.
Thank you, Doc.
Thank you, Dr. Max.
All right.